Hi, I'm Dr. Jeff Raber with the Werc Shop. I'm here today with Marijuana Movement to talk a little bit about the laboratory and the functions that it serves. I've got a PhD in organic chemistry from USC in 2002, help each patient discover and find what's the best medicine for them and ensure that it's quality controlled and safe to consume. We started in April of 2010. We've been around a little over 2 years, with a year of planning before that to choose which equipments would be the right way to go about analyzing the medical cannabis in the market in California. And our ultimate conclusion came to a liquid chromatograph. And in fact, we purchased the brand new type, and it is really what the FDA is looking for from every company nowadays in the pharmaceutical world. What does your liquid chromatograph tell me is in your product? Strain A has 15% THC, strain B has 15% THC, and strain C has 15% THC. Yet all of the physiological effects through each of those was very different. What does that tell you as a scientist? It says THC is not the only component that is dictating the effects of the medicine. There's something else there. But the other components that are prevalent are the terpenes. Terpenes are the volatile compounds that you smell and taste that give you the flavor and also produce very predominant effects. This is being technically termed as the entourage effect, and that relates to what's in the flower or the concentrate or the edible, as well as what's the method of consumption. Our job as the laboratory is to first decide and to find out exactly which chemicals are present, to deliver that information to the patients who can then standardize the medicine at home. And that's why we're embarking on the terpene analysis. By looking for over 35 different terpenes at once, over 8 different cannabinoids, we have a very broad picture of what's being provided by the plant products to each patient. We pride ourselves in speed, and the cannabinoids and terpenes typically come around in about a day, 24 hours or so, depending when they make it to the lab. We actually go and collect the sample to ensure it is an accurate, valid sample. We do not like to accept a single bud, because that's only the test for that bud. It's not a test over a representative amount like a pound. The second element of safety is pesticides, and we use a mass spectrometer behind our gas chromatograph to analyze the pesticides. It's an exceptionally complicated problem, and I think it's important to note and to educate everyone that right now in California, the use of pesticides on medical cannabis crops has been ruled illegal by the California Research Commission. If you are utilizing those, we are going to start to find it, and we have found it for some. Then the cultivators become aware of what the abilities the lab has, and they start to clean it up. So is there a need for safety screening? Absolutely. It is one of the biggest things we do, and as a patient, ask your dispensaries, ask your providers, have they assured or quality checked their products to know that they are clean. So why did we pick the ultra-fast liquid chromatograph as our first piece of equipment to acquire? And the choice was its breadth and utility. So we're about to inject another sample. And you'll see the auto sampler do its magical thing, where it will go about, grab the 1 microliter of solvent from the vial, we'll come back over into the injector and mixing chamber, and it will go in and inject the sample. After our machine injects the sample, the running solvent runs through the same place to make sure it's clean, and there's no what they call carryover of that sample for the next one. So with this equipment, the liquid chromatograph, it's important not to be able to just buy one, but to be able to know how to use it properly. And that's where our combined experience in this laboratory really shines. And you hear me mention that we analyze cannabinoids. By cannabinoids, I mean THCA, THC, CBD, CBDA, and all of the components that are native to the cannabis plant that lend to a lot of their medicinal benefits. For analyzing all of the cannabinoids that are made, especially the ones native to the plant and their derivatives after that's heated, you need a liquid chromatograph. This is our gas chromatograph, and we use this to analyze both our pesticides and our terpenes. We have 2 different ways of using the same tool. We are using terpene profiling to identify the strain to know for sure that the train wreck that you are acquiring is actually train wreck. From a patient perspective, you want to be sure the medicine that worked for you is the same one you're getting next time, not playing flavor of the week, the name game, or what's the new ones. So I think patients, you're paying a lot of hard-earned money. This is not covered by insurance currently. You really have the right and to demand that these things are known to you, and that ability exists through our labs and other labs that can offer that. So I think it's important to ask as a patient and start to demand that of your collectives manager.